CNA written exam, Prometric practice test. Question 1. A nurse aide is walking a resident using a gait belt. The resident tells the nurse aide she feels dizzy. The nurse aide should: Option A, hold the gait belt tighter and ask the resident to rest for a minute. Option B, suggest the resident lean on the nurse aide for more support. Option C, guide the resident over to the handrail and ask to hold. Option D, ease the resident to the floor if a chair is not available. The correct answer is option D, ease the resident to the floor if a chair is not available. Question 2. While feeding a resident, the nurse aide notices that the resident is coughing a lot after each drink of fluid. What is the appropriate response by the nurse aide? Option A, allow the resident more time to swallow. Option B, use a straw when giving the resident fluids. Option C, add a thickening product to the resident's fluids. Option D, stop feeding and ask a nurse to check the resident. The correct answer is option D, stop feeding and ask a nurse to check the resident. Question 3. Which of the following best describes the daily routine needs of residents with dementia? Option A. It is important that the resident's day be kept full of activities. Option B. Changing daily routine is often helpful to residents with dementia. Option C. Provide opportunities for activity and periods for rest is important. Option D. Following a strict schedule is required to decrease confusion. The correct answer is option C. Provide opportunities for activity and periods for rest is important. Question 4. A resident is admitted to the nursing home for rehabilitation after a stroke. The plan is for the resident to stay only a short time before returning home. Which of the following shows the best support of the resident's needs? Option A, provide total care for the resident. Option B, set high standards for the resident's achievements. Option C, help the resident focus on even small accomplishments. Option D, remind the resident that she will be happier when she is home. The correct answer is option C, help the resident focus on even small accomplishments. Question 5. While bathing a resident who is comatose, the nurse aide notices a reddened area on the left hip. Once reported, the charge nurse is likely to request that the nurse aide: Option A, massage the area using lotion. Option B, apply a dry protective dressing over the area. Option C, keep the resident positioned to avoid pressure on the hip. Option D, cleanse the hip using extra soap, then rinse and dry thoroughly. The correct answer is option C, keep the resident positioned to avoid pressure on the hip. Question 6. The first step the nurse aide should take when discovering a fire is to: Option A, check how quickly the fire is spreading. Option B, remove any residents near the fire. Option C, throw a blanket over the fumes. Option D, pull the alarm. The correct answer is option B, remove any residents near the fire. Question 7. Which of the following is an observation often seen when a resident is impacted? Option A, liquid feces seeping out of the anus. Option B, darkening of the resident's urine. Option C, many soft, formed stools. Option D, bad breath odor. The correct answer is option A, liquid feces seeping out of the anus. Question 8. When a resident has an indwelling urinary catheter, the nurse aide should expect that the resident's care plan will include: Option A, limiting activity by keeping the resident on bed rest. Option B, emptying the urinary drainage bag every 2 hours. Option C, keeping the area where the catheter enters the body clean. Option D, toileting the resident every 2 hours for bladder retraining. The correct answer is option C, keeping the area where the catheter enters the body clean. Question 9. Which of the following is an example of disinfection? Option A, washing a resident's hands after toileting. Option B, using a wipe to clean around a resident's stoma. Option C, cleaning a shower chair with a chemical cleanser. Option D, cleaning a resident's bath basin with soap after use. The correct answer is option C, cleaning a shower chair with a chemical cleanser. Question 10. A resident tells the nurse aide about being bored. The resident says, "My days seem to last forever." What should the nurse aide do? Option A, tell the resident, "I know what you mean, my days seem long too." Option B, ask the charge nurse if the resident can have some medication. Option C, ask about activities the resident has enjoyed in the past. Option D, tell the resident to check the activity schedule. The correct answer is option C, ask about activities the resident has enjoyed in the past. Question 11. A resident has a contracture of the right arm. When putting on the resident's button-front shirt, the nurse aide should: Option A, put the shirt sleeve on the left arm first, then the right arm. Option B, ask which arm the resident prefers the sleeve to go on first. Option C, put the shirt sleeve on the right arm first, then the left arm. Option D, raise resident's arms up to slide both sleeves on at the same time. The correct answer is option C, put the shirt sleeve on the right arm first, then the left arm. Question 12. A resident with advanced directives has a DNR, do not resuscitate, order. This means that the resident: Option A, does not remember. Option B, should not be restrained. Option C, does not respond to instructions. Option D, should not be resuscitated. The correct answer is option D, should not be resuscitated. Question 13. After reporting the observation of a red area on the resident's hip, the nurse aide should expect that the option A resident will be placed on a short-term bed rest. Option B area will be covered with a protected dressing. Option C area will need frequent massage with a moisturizing lotion. Option D resident should be positioned to avoid pressure on the area. The correct answer is option D, resident should be positioned to avoid pressure on the area. Question 14. Which of the following actions helps to prevent skin tears? Option A, keeping side rails raised. Option B, using less lotion on the skin. Option C, sliding the resident up into bed. Option D, dressing the resident in long sleeves. The correct answer is option D, dressing the resident in long sleeves. Question 15. When a resident is not able to stand, the resident's height is usually measured by option A, having coworkers hold the resident upright to allow for the measurement. Option B, adding the length of legs, chest, and neck/head to determine the height. Option C, asking the resident's height and subtracting an inch for age-related shrinkage. Option D, taking the measurement from head to heels while the resident is flat in bed. The correct answer is option D, taking the measurement from head to heels while the resident is flat in bed. Question 16. The normal appearance of urine is option A, clear. Option B, cloudy. Option C, dark yellow. Option D, strong smelling. The correct answer is option A, clear. Question 17. Which of the following is the most appropriate schedule for residents who are incontinent to receive perineal care? Option A, in the morning and at bedtime. Option B, at the beginning and near the end of a shift. Option C, whenever the resident is soiled with urine or stool. Option D, every 2 hours when the nurse aide checks on the resident. The correct answer is option C, whenever the resident is soiled with urine or stool. Question 18. When providing foot care, the nurse aide observes an open sore on the resident's foot. The nurse aide should, option A, pat gently to dry and cover with a dry dressing before applying a sock. Option B, stop the foot care immediately and ask the resident what happened. Option C, report the skin opening to the charge nurse as soon as possible. Option D, check the resident's sock for any wound drainage. The correct answer is option C, report the skin opening to the charge nurse as soon as possible. Question 19. A resident whose husband died a few years ago says, "I have got to get dinner started. My husband will be home from work soon." What is the best way for the nurse aide to respond? Option A, offer to walk with the resident to the activity department's kitchen. Option B, remind the resident about her husband's favorite dinners. Option C, ask the resident about the husband's favorite dinners. Option D, explain gently that the resident's husband is dead. The correct answer is option C, ask the resident about the husband's favorite dinners. Question 20. To help soften the beard before shaving with a disposable razor, the nurse aide should, option A, massage the beard area of the face. Option B, rub the beard in the direction of the hair growth. Option C, hold a warm, wet washcloth against the face first. Option D, lather the face with soap instead of shaving cream. The correct answer is option C, hold a warm, wet washcloth against the face first. Question 21. A resident's care plan provided the nurse aide with information about option A, the financial arrangements made for the resident's care. Option B, specific care required for the resident and the goals of care. Option C, facility procedures for performing different nursing care procedures. Option D, the nurse aide's assignments and when care is provided to each resident. The correct answer is option B, specific care required for the resident and the goals of care. Question 22. The goal when removing gloves that are soiled is to, option A, remove quickly since there is a risk of exposure to germs. Option B, dispose of the gloves in a biohazard-safe trash can. Option C, avoid contact with the outside of the gloves. Option D, keep germs in the trash can area. The correct answer is option C, avoid contact with the outside of the gloves. Question 23. The nurse aide notices that a resident with dementia keeps walking over to the piano, pausing there, touching the piano, and then walking away only to return again. Which of the following is? Option A, take the resident back to the resident's room. Option B, distract the resident by asking about the resident's family. Option C, invite the resident to sit down at the piano with the nurse aide. Option D, ask the activity director to find something for the resident to do. The correct answer is option C, invite the resident to sit down at the piano with the nurse aide.